And good morning, and welcome back to Preserve Health Talks. I'm Dr. Ira Perlstein with my co-host, Leah again. And this morning we're privileged to have with us a functional medicine specialist all the way from Idaho Falls, Idaho, Dr. David Bilstrom. Good morning, Dr. Bilstrom.
Good morning. Glad to be here.
I hope it's not too early. Hope we didn't get you out of bed for this, but I think it's going to be worth your while. So we want to start by talking about what you do, about your practice, and then have you explain to us what functional medicine is. So I'm going to have Leah start with the questions.
All right, so let's start with your new practice. What inspired you to launch a concierge functional medicine practice, and why did you choose to offer it exclusively via telemedicine?
There's a huge need for help with chronic disease management, both prevention and reversal. And there's just not somebody in every community that knows how to do this. I'm hoping that will be the case eventually. But the telehealth makes it so accessible for people. A mother can be in car line waiting to pick up her children and do a visit. Dad could be at lunchtime at work. Kids can, be an hour late to school. All this other kind of stuff. It just makes it so more easily accessible. And the concierge medicine allows you to spend plenty of time, hour per visit at least. Hey, I'll see you tomorrow if you need more time. And we can really dive deep into what's going on in order to ideally prevent chronic disease before it happens. Or if you already have chronic disease, get in a position where it can actually reverse the entire process and make it go away.
So, Dr. Bilstrom, tell us, how does your model work from a patient perspective, and what does a typical visit or membership look like for your patients?
So the membership is just a monthly membership fee that they pay, and unlimited visit, unlimited time. I'm available, as is my nurse, 9 to 5, Monday through Friday. They can call my cell, my nurse's cell. We're there. Fortunately, and when it comes to chronic disease prevention or reversal, there's really no emergencies, but we always want to have this access so we can answer questions and fine tune and problem solve even outside of the clinic.
So, for listeners who are unfamiliar with functional medicine, how would you define it and how does it differ from traditional allopathic medicine?
So functional medicine tries to answer the question why somebody has what they have, rather than, oh, here's an issue that you have, here's a medicine to try to address that issue, but that medicine really isn't fixing why they got that issue. And if you don't address why you get an issue, that why just keeps pushing you to new problems on top of old problems. So in more traditional allopathic medicine, where it's what symptom do you have? Here's a medicine for it. Well, then you're going to come back later for another symptom and get another med, another med. And as people are seeing, especially in the generations, like their parents and grandparents, is you can be on a dozen meds and you're still getting, not feeling great, but also you're still getting new stuff on top of the old stuff. By addressing the root cause, why they get it with functional medicine, we can really get rid of whatever they got, including everything is so connected in the body. Even though it might be a totally different organ system, it's connected. And so when you get to the root cause, you're really addressing everything at the same time.
So, a lot of biochemical pathways, and does your diagnostic process differ compared to a standard primary care visit? Say something that I would do. A patient comes to see me with, say, diabetes or high cholesterol, and I try to find the cause of that, modify their diet, their lifestyle, and then use medications to treat it. But how does your diagnostic process in functional medicine and your treatment differ than, say, what I would do as an allopathic doctor?
Well, typically, when somebody gets a first symptom of something, they wake up and they go, geez, where'd this come from? I don't know. Usually it's about a 10 to 20-year process. It starts at the cellular level and it starts building, the body's trying to correct it. And then eventually when the body just can't keep it under wraps anymore, hey, I just woke up and my right knee hurts, or I woke up and my blood pressure is higher than it should be. So it starts with the original health questionnaire, where we ask questions about when your mother was pregnant with you, what happened during the birthing process, that's childhood history, family history, menstrual history. You take it all, and you can really see a timeline of when things started and how things have been added on top of it as time goes on. And seeing that timeline tells you so much about what you need to go, oh, well, this is why they ended up with this stuff. I can see it starting way back then, including previous generations, because of epigenetics and because of the microbiomes in the body. Those things get passed on from generation to generation. So you can actually see this in a multi-generational form. And then even before you start asking them questions or before running any labs, you got a really good sense of sort of how this all got going and how you can unwind it. Now, the more traditional diagnostic stuff might look fairly similar. Hey, let's do a blood test. Okay, we're going to find out kind of what's going on with the blood test. But a functional medicine blood test would tend to be a lot more detailed because we know where this stuff comes from. The science is very clear where chronic disease comes from. And so we go, okay, well, this is what we got to test. You can get the blood work done in any lab. It's not like it's something that is so unusual that any lab can run this stuff. But we're going to take a real deep dive into nutrition deficiencies or imbalances. We're going to take a dive into your hormones, hormone symphony, all of them together. We're going to look really closely at your thyroid, closer than even endocrinologists would look at a thyroid issue. We're going to take this real deep dive, and we're going to see things. It's kind of cheating because we know where this stuff comes from. We know what to look for, and we're going to see it creating the issues you have now, but we're going to see what's going to give you a problem, autoimmune disease, cancer, heart disease in 10 to 15 years. But then we have 10 to 15 years to turn it around before you ever get there.
Do you ever work alongside a patient's primary care doctor or specialist, or do patients typically transition all of their care to you?
Oh, I always want to work with primary care doctors, more traditional primary care docs, or concierge primary care docs, of course, would be the best option. Like I mentioned before, is everything I'm helping people with is really chronic. Either we're trying to catch a chronic disease decade before it starts, and I've already had these chronic stuff, we're going to try to turn it around. And so there's really nothing that's an emergency. And so, but we do need somebody to have a primary care doc because an emergency does happen, appendicitis, a car accident, something like that. You need somebody that knows you well and can help you through, those kind of things. But also, the traditional preventative medicine stuff, like, hey, it's time for your mammogram. Hey, it's time, these kind of things. Hey, we got to, do a prostate exam. Those are the kind of things that primary care providers are great at. And we need that kind of stuff right along with this. And so it's really melding the best of kind of both worlds when you have traditional allopathic and you have functional medicine together.
So, are you seeing more patients, say, with undiagnosed or complex symptoms like fatigue, brain fog, chronic pain, or patients with well-established diagnoses like diabetes, hypothyroidism, high cholesterol, and they just want an alternative approach?
There's epidemic of every one of those things you mentioned. Oh my gosh, is it hard to stay healthy nowadays? It's crazy, whether it's kids, whether it's an adult, it is crazy how hard it is. And so when you look at that stuff, I would say, brain fog, fatigue, these kind of things, in more traditional allopathic medicine, they would be sort of non-specific symptoms. Now, to me, they might say something a little bit more specific, but when I would look at elevated cholesterol and elevated blood pressure, I would look at that as not so much a documented disease. I would look at that as just another symptom of the big picture. Okay, so why is your blood pressure up? Okay, why is your cholesterol up? The liver makes cholesterol. We would be dead without cholesterol. You need cholesterol in order to produce vitamin D from sun exposure. You need cholesterol, they call it the mother of all hormones, made by the liver, to make testosterone, estrogen, progesterone, DHEA, vitally important hormone to keep away heart attacks and strokes and joint pain and boom, 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 all these kind of things. You need it to make all these important things. But when the liver is making more than seems appropriate, you want to go, hey, why would the liver be doing that? This is a symptom of something bigger. And then ideally, we can use that information to get in a position where, because everything is connected, these central mechanisms that we tend to look for and test for and figure out, they're driving the brain fog, the fatigue, the abnormal weight gain, slow metabolism, the cholesterol issue, the blood pressure issue, the blood sugar issue, all at the same time. And this is where, when you get the simple stuff like blood pressure, we go, okay, that's a symptom of something else. But also, we have so many people nowadays that have so much going on at the same time. How can every organ system be disrupted at the same time? This is crazy. Very confusing to more traditional allopathic medicine. Well, how can everything be terrible at the same time? For functional medicine, I would say, makes it easy. It's like, well, there's only one way that everything can be whacked at the same time. So the important central mechanisms are off, that's driving everything crazy. We address these, we're in a position to fix everything at the same time, including if people are on medications to take care of things like a blood pressure issue, because you don't want to have a stroke or heart attack. Of course, you want to use blood pressure medicine if it's running that dangerously high. But we can fix this, and then maybe you don't even need your blood pressure medicine. Maybe your cholesterol comes down all by itself, and they don't even need the cholesterol medicine. And the body takes over and does the work itself and may not even need the help of those prescription medicines eventually.
So since your practice is fully virtual, how do you ensure patients still feel connected and cared for without that in-person element?
You'd think that the in-person element inherently would be better. I would maybe think that, hey, I'm seeing my doc. But what most people's experiences with primary care providers or a lot of specialists, because there's so many sick people, holy cow, maybe they only have 6 minutes with their doc.
Right.
Or maybe the nurse practitioner comes in and then the doc comes in for 2 minutes and says, okay, this is the medicine we're going to put you on. Well, then the doc walks out. You don't have a chance to ask any questions, get any answers. And it might feel very impersonal, even though it's in person. Where with the telehealth, I love it. They're sitting in their living room. They're sitting in their kitchen. I can see family portraits behind them. I can see their dog on their lap. And I'm like, oh, what a cute dog. Oh, my goodness, what's your dog's name? Oh, and then we tell dog stories. And I go, oh, my gosh, those are the cutest baby pictures behind you. Who's that? And they tell, oh, that's my grandchild. So actually, you're actually almost doing like a home visit. What's more personal than doing a home visit where you get to see the person in their own element. You get talking about stuff. You get to know them really as a person. You even know their living room, what it looks like, and what I think is even more personal than going to sort of an impersonal clinic for 5 minutes of walking out going, man, that was quick, kind of living.
So looking ahead, and we try to look ahead, but do you see virtual concierge functional medicine, particularly functional medicine, becoming more mainstream, or is it still a niche service? Because there seems to be so few providers like you out there, and what you're doing seems so worthwhile.
Oh, well, thank you for saying that. I really think so because, people want to be part of their healthcare team nowadays, I think. A generation or two ago, you walk in the doctor's office, he tells you what medicine you need. You don't ask questions. Well, tell me more about this. Why do I need it? It's just, oh, okay, sure. But then you can see the limitations of that, where people just get on multiple meds. They still get sick. They still get the cancers and the Alzheimer's and the dementias and the diabetes. Where now people say, well, I don't want that to happen to me. My parents, my grandparents, I can see that, and I see the limitation. I want something different. And I'm willing to go online. I'm read about stuff. I want to learn about this stuff. And I want to learn about why I have this stuff or what I got to do to avoid this stuff. And so they really want to be part of the care team. And I think that functional medicine is really, that's just what it is. It's really a team effort. I want to hear what you have to say. I want to share with you information. You share with me what you know. We're going to put all that together for a plan. And I want you to tell me if it feels right to you. But they're like, yeah, I'm going to do what I need to do. Thanks for really setting a path for me. Because I felt kind of lost. I had all this information. I didn't quite know how to consolidate it. And I'll help them with that. And then they feel so empowered. And if you're told you have a chronic disease, you might ask your doctor, well, where did this come from? And they may say, let's say like an autoimmune disease, rheumatoid arthritis, could be cancer. Cancer is the flip side of the same coin as autoimmune disease. So anything that drives autoimmune disease is driving you towards cancer. We don't need that. But we can go back and go, okay, well, let's see what we got to do We're going to empower you, give you this information, these tools that you can use to actually get rid of this thing that maybe people told you you couldn't get rid of. And then they go, oh boy, I got the knowledge and the tools and the path I need to do this. And if you feel empowered, you're like halfway there towards preventing and reversing chronic disease. If you have all that power taken away, oh my gosh, you got no say in this. And we know that is not a good place to be if you want to stay healthy. You need to feel like you can do something and be successful.
2 quick questions before we leave because we're running out of time. The first, we'd love to have you back. Would you like to be back on our show?
I'd love to. This is a big subject.
It is. And we've just barely scratched the surface. Secondly, and we're going to flash your name on the bottom of the screen with a way to contact you. But if someone wants to join your membership functional medicine practice, how do they go about doing so?
Well, you can get to my website, which is the drdavidbilstrom.com. And of course, you can go straight that way. Now, you also, though, could access so many educational tools, including there's a free online educational email course, 7 emails, 1 a day for 7 days. You can go through as slow or fast as you want. Each one's only about a 6 to 8 minute read, but it takes a real deep dive into why this stuff happens and gives you some really solid information about how you can reverse this. And so you can really almost like do a training run of, well, does this sound like me? Does this sound like something that I could get my hands around and would really be helpful long before you even decide if you want to be a patient or not?
What a refreshing approach to the practice of medicine. Thank you so much for joining us this morning. We can't wait to have you back. Once again, thank you for joining us, all of our viewers, for another episode of Preserve Health Talks.